Hi, Dr. Yas here. I wanted to speak out on the meteoric and incredibly outrageous rise in the number of hip and knee replacements that are being performed pretty much worldwide, as well as the meteoric and quite surprising number of revisions of hip and knee replacements that are being performed. Something seems awry that suddenly over the last 5 years of the history of mankind that everybody's hip and knee seems to be bone on bone. The way the system works is that you have pain in the knee region or hip region, and you go to a medical provider, they take an x-ray, and they show you a picture indicating that you are supposedly bone on bone, and the presentation or the justification that you're being bone on bone is nothing more than the x-ray. They show it to you as if you have the ability to interpret whether what they're showing you is valid or not. It is a horrible situation to be in. You don't know enough about the medical situation or the ability to differentiate what is being provided on a diagnostic test like an x-ray. And the premise is that this medical person with this incredible amount of supposed experience says, look at the picture and you see how it's showing your bone on bone? And you simply have to say, well, he says or she says it's bone on bone, so therefore it must be bone on bone. Well, what I want you to understand is that there has to be a physical presentation of the joint. You don't need a image that's interpreted by a medical practitioner to determine whether your joint is bone on bone. The way to determine if you're bone on bone is to look at the range of motion of the joint. So let's say that we're looking at a knee joint or even a hip joint, and we take the unaffected leg's range of motion of the hip or knee joint and we see how far it can go. And then we take the affected leg, the leg where you're experiencing the pain, and you check the range of motion. I would guess that in almost every one of the cases of anyone that's being told they're bone on bone, that they have pretty much, if not full, range of motion of the affected joint. If you have almost full, if not complete range of motion, you can't be bone on bone. It is an unequivocal, irrefutable fact. If in fact you were bone on bone, take the phrase bone on bone. What does that mean? It means that there's no longer a joint space between the two bones that make up the joint. Why did you even have a joint space? Why does every movable joint of every person on the planet who is generally healthy, why do they have a joint space which is held by a meniscus, which is cartilage, or a labrum, which is cartilage? The purpose of having a joint space is because when you try to move your joint, the bones have to actually shift on one another. It's called gliding. They actually don't stay in exactly the same position. They actually shift ever so slightly in the joint. And there has to be a space between those two bones for this shifting or gliding to occur. So, if you were in fact bone on bone, there would be no space between the vertebrae based on the words bone on bone. Therefore, without a joint space, gliding could not occur. If gliding could not occur, you could not actively put your joint through range of motion. So, if in fact you were bone on bone at the knee or the hip, you would expect to see a major loss of range of motion, and at that point where the motion is inhibited, it would feel like if you tried to push through that spot, a bone was hitting another bone. It has nothing to do with the presentation of pain. Pain through range of motion is not an indication of bone on bone. Let's make this absolutely clear. What indicates that you are bone on bone is that there is a major loss of range of motion, and at the point where the range of motion ends, it feels like a bone is stopping the other bone from moving. That is the physical presentation of being bone on bone. Anything other then that presentation should never be taken as a valid indicator that you're bone on bone. So let's start to get away from x-rays, get away from going to any medical practitioner who does not use your physical joints presentation as the indication as to whether you're bone on bone. You will end up getting a surgery you never needed. That is why you have pain after the first surgery and are then told that a revision is necessary. You will be told, and people who I've treated have been told, oh, that the prosthetic wasn't put in properly, the prosthetic broke, and that's why you're still having pain. If there's such a massive number of revisions that are needed to be performed based on the original surgeries, doesn't that indicate that either the surgery isn't being performed correctly or the prosthetic components don't justify being implanted because they break down so quickly? Or is it simply that the cause of your pain is actually muscle, and that in performing a joint replacement, you cause such severe post-surgical symptoms such as swelling and pain that it inhibits you from weight bearing on the limb, which leads to greater weakness, which causes the muscles that had strained and were eliciting pain before the surgeries to actually elicit more pain because it's straining more. Doesn't that sound more like it's a logical reason for having the same, if not greater, pain after these surgeries versus the idea that the surgery was performed correctly and somehow the prosthetic gave way or that the prosthetic broke? None of that makes sense. It's absolutely illogical to believe this at the level that these revisions are being performed. So let's just try to understand that if you're told that you need joint replacement because you're bone on bone, ignore everything and everybody who is attempting to tell you that the answer to understanding whether you're bone on bone can be seen through an x-ray or interpreted from a medical practitioner. The only indicator as to whether you're bone on bone is if you have a major loss of range of motion of your joint, and at that end point, it feels like a bone is impeding another bone from going through range of motion, and that's why you have the blockage. Pain has nothing to do with interpreting whether you're bone on bone. It has nothing to do with it. Bone on bone implies that there's no joint space. If there's no joint space, the bones that make up the joint cannot glide on one another, and therefore you see a major loss of range of motion in your ability to move your joint. If you have any questions about this issue, if you are being told that you need a joint replacement and you are wondering whether this is valid or not, you need to get the right information, or you will end up like so many others who have the same if not greater pain after the original surgery. If you want more information, I would suggest you contact me by going to my website, which is www.mitchellyas.com, MITCHELLYASS.com, or contacting me through my email address, which is drmitch@mitchellyASS.com, Dr. Mitch at mitchellyas.com. Please contact me before you get a surgery you never needed. I have been doing this for 2 decades. I have seen thousands of people, and I have seen the effects of unnecessary surgeries. They are horrible. People's lives are being destroyed based on the idea that for some crazy reason, which I don't have an answer for, in the last 5 years, the majority of the planet's joints have now decayed to the point where everybody is bone on bone who happens to have pain somewhere in the hip, gluteal region, groin, knee. Somehow the result is just this complete decay of knee and hip joints, and therefore everybody's getting joint replacements or requiring it. I really need you to think twice about falling into this category. If you want the real information, you get it through the Yas method. As I said, go to my website, contact me through my email address. Let's make sure that if the pain is actually a result of muscle, you don't get a surgery you never needed, which can lead to the end of your chance of ever getting the benefits that you thought from the treatment you were getting, which is to resolve your pain fully and achieve you to full functional capacity. The YAS method can do that. It can actually differentiate through its mechanism of interpreting the body's presentation of symptoms, whether the cause of that pain is the joint, which it is in 2 or 3% of cases, or muscle, which it is in more like 95 to 98% of cases. Get the right information. Let's make sure you get the treatment you need so you can have the quality of life you deserve. This is Dr. Mitchell Yas saying, bye-bye.